presented by the School of Public Health at Georgia State University. My name is Brian Greer, and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is urban transportation environments, the mission-critical factor in addressing our air pollution and climate change problems, plus so much more. Our guest is Dr. Roby Greenwald, who is an associate professor in the Department of Population Health Sciences in the School of Public Health. Dr. Greenwald earned his BS from Clemson University and an MS and PhD from the Georgia Institute of Technology. His primary research interests are measuring the ways in which air pollution influences human health, and much of his work involves the development of unique sampling systems for assessing exposure to air pollution and special microenvironments, such as inside vehicles while commuting. From 2009 to 2014, he was on the research faculty of the Department of Environmental Health at Emory University. From 2005 to 2008, he was a postdoctoral fellow in Emory's Department of Pediatrics and worked on a project investigating the influence of air pollution exposure on pediatric asthma patients. From 1999 to 2005, he was a PhD student at Georgia Tech and worked on two projects: development of an instrument to measure water-insoluble aerosols in real time and computer modeling of the influence of atmospheric particulate matter on crop production. Prior to graduate school, he taught beekeeping as a Peace Corps volunteer in Benin, West Africa, and studied civil engineering at Clemson University. Today's webinar will be guided by three general questions. What are you doing? Why is it important? And how can we get involved? A quick note, if you have a question at any point during our conversation, please feel free to type it into the Q&A box and we will try our best to answer. So with that, let's begin. Dr. Greenwald, welcome to the webinar. Please tell us about your research. What are you doing and why is it so important?
Hey, thanks a lot, Brian. I'm really happy to be here. And I would like to start this off by just kind of going over a story to describe a little bit, how did I specifically get into this particular area of research and why is my research focus now really mostly on transportation environments and how we can improve public health through addressing issues related to transportation. So I got started in the air pollution game by way of climate. So my primary interest when I first started grad school was on climate change. I worked on a lot of projects that were focused specifically on how air pollution emissions are affecting climate. Here's a picture of a much younger version of me on top of the Greenland ice sheet. We're doing a project up there looking at how air pollution emissions are reaching the ice sheet and affecting how the ice is melting in some cases. From there, it kind of transitioned into looking at how different air pollution exposures are, how you're exposed in different environments. This is a picture here of a project we did several years ago, looking at people who are commuting on highways in Atlanta. And then we're also measuring a lot of things about what their health response to that is. And then I kind of transitioned into more of your traditional public health type research, where we're looking specifically at human health response to air pollution exposures. So my interest has always been on how air pollution is affecting human health, but over the last several years, my focus has started to shift a little bit. And a good way to describe that is that for most of my career, I've really been documenting air pollution problems, trying all kind of novel approaches to do a better job of documenting it, to do a better job of measuring your air pollution exposure in different ways. And we've really made a lot of progress. Other collaborators and colleagues around the country, around the world have made similar progress. And we've gotten a lot better at this. So I don't want to undersell this, but we've done a good job. But to be frank, over the last 5 years or so of my career, I've kind of gotten tired of just documenting this problem over and over and over again. And with what we need to transition into is start addressing the things that are making the problem, actually solving the problem instead of just measuring it over and over and over again. So this is really how I've started to make this transition into more transportation focused research. And the reason for that is all of these projects that we've been working on for the last several decades have told a very similar story. Your exposure to air pollution is really a function of how exposed you are to motor vehicles. We know that the cause of most of the air pollution in cities in the United States is motor vehicles. And so what we're really trying to address here is, can you hear the GSU marching band right outside my window?
Yeah, it's homecoming here at GSU. So yeah, we're getting a show right now.
Sorry, that was unexpected and poor timing. I apologize for that. But anyway, I'll just keep going. I'll just pretend like they're the musical accompaniment to this presentation here. So what I've tried to transition to since then is really looking at ways that modifying the transportation system can actually reduce your air pollution exposure, but it does way more than that. So there's a lot more to this story than just air pollution. In the United States, motor vehicles are just the major cause of air pollution, but they're also a serious cause of injuries, both fatal and non-fatal traumatic injuries. Are 40,000 deaths per year in the United States from this cause alone. That works out in the Atlanta area to about 2 deaths per day somewhere in the Atlanta metro area due to motor vehicles. The injuries from motor vehicles, the number of people who have premature deaths from chronic exposure to the emissions from these vehicles is actually a bigger number than that. It's about 60,000 people per year in the US. But in addition to this, they are the single largest source of carbon emissions in the United States. In other words, they're the single biggest contributor to climate change from the US's carbon emissions. In cities around the US, are the dominant source of noise. Noise has significant public health impacts as well. It generally raises your stress levels and causes all kinds of downstream health effects from that. They're a major contributor to people not getting enough physical activity. Some of this is related to not just getting physical activity while going from one place to another, but also you're less likely to be walking for other reasons if there's lots of vehicles around you. Also, they're extremely expensive. The average cost in the United States for owning a vehicle, this is the average, not the extreme. The average cost is $1,000 per month once you include all of the insurance, maintenance, fuel, as well as the cost of the vehicle itself. It's a very expensive form of transportation. But in addition to the vehicles, the infrastructure also has major public health effects. Massive infrastructure to accommodate large numbers of vehicles has a tendency to divide and disrupt communities. Showed a Google Street View picture here of streets that used to connect across an interstate, but now you can't go from one side of the interstate to the other because there are, the cars themselves are a barrier. There's walls. This practice contributes to social isolation. We see this, there's several different studies that have been done measuring social isolation as a function of transportation. Parking infrastructure also has serious negative health consequences. If a parking structure is being built for like a new development, the average cost of a space in a new parking garage is about $25,000 per space. That cost gets passed on to the person who is renting that space, renting an apartment in that development. It doesn't really matter if you have a car or not. That cost still gets passed on to you. In addition, it consumes lots of real estate in areas where that could be used for some other purpose. I showed a picture here of the central part of Atlanta. The building in green, right in the middle of that image, is the Urban Life building on the campus of Georgia State, and this is where the School of Public Health is housed. And all of the purple buildings in that image are entirely parking structures. In other words, that is a parking garage. The whole entire building is devoted to parking. And the buildings that are shaded in green have parking on lower levels, but some other use on higher levels. When all of this is included into an urban landscape, this increases the distance between points. And so that means that it makes it harder to walk from one spot to another. It makes it more likely that you'll end up using a vehicle to go from one spot to another, which means that there'll need to be more parking structures, which means that now the destinations are even further apart. It's a feedback loop that makes the situation more difficult to control. And something else that has to be said about this is that this is true for lots of different areas of public health. Like, all of these issues are wildly inequitable. What I mean by that is that the negative health ramifications fall on one portion of the population way more than they fall on other portions of the population. And those tend to be the more disadvantaged portions of the population. So anyway, in order to address a lot of these issues, we kind of have to make a paradigm shift. We have to change the way that future developments happen so that we do not perpetuate and expand some of these problems. But in order to do this, to make some of these changes, we have to deal with a couple of important psychological phenomena that really shape how any kind of change happens in any area of life, not just transportation. So one of the ones that are important important phenomena we have to address is this phenomena, the psychological phenomena we call normalization. And what we mean by that is that if something is super common, you see it all the time, every day, you start to think about it as being normal, as the way things should be, as the way things ought to be. And an example I like to use of this is if you go back a couple of generations, it was very, very common, very, very normal to see people smoking all the time. The advertisements really kind of played on that. It's like it's a normal thing. But just because it's common and it's everywhere does not mean it's good, and it does not mean it doesn't have harmful effects. And so if we kind of switch our framework so we don't see it as being normal anymore, it's a lot easier to address change. And another phenomenon we kind of always have to keep in mind is this phenomena called loss aversion. And loss aversion means you feel way more pain about losing something than you do joy about gaining something. And on average, that's about a 2-to-1 ratio. You'll feel more pain about losing $10 than you will for gaining $20. And so in other words, if we make a change in really any area of life, but especially how we get around our cities, if you make a change and people feel like they're losing something, they're going to be resistant and hesitant and have a lot of pushback to that. So in other words, to make changes to our transportation systems that are going to reduce all of these public health problems, we really have to emphasize that we are gaining something important. We're really not losing something. You're not losing mobility. You're gaining improved health. Something I think that it's super important to talk about when we talk about future transportation systems around cities like Atlanta is that our cities are growing. Atlanta is no exception to that. The Atlanta Regional Commission expects that the population of the metro area will grow by about 3 million people before 2050. Those people are moving here for really important reasons, economic opportunities. There's the urbanization process is happening all around the world. This is not slowing down anytime soon. And those people are going to have to live somewhere, and they're going to have to get from one spot to another. And if we just assume that every new person that's moving to this city is going to be driving a car from one spot to another, it's not physically possible to accommodate all those vehicles. Any new person added to the roadway just means that congestion gets worse for everyone else. So in other words, it's in our interest to make as many of those new additions to the city as possible be able to get around without a vehicle. And we have to make actual changes to make that happen. So a couple of the changes that I think that we really need to address here is what I really want to focus on for the future parts of my career is that we have to make it safe, pleasant, and convenient to get around the city without using a vehicle. There are ways that we can do this. The United States, sadly, over the last couple of decades, has fallen behind a lot of our peer nations on really most issues that are related to transportation. And that's unfortunate for us, but there is a silver lining to that. We get to see how other people have done things that work. And we also get to see how other people have done things that didn't really work very well. And we can use some of those lessons to make changes that actually work and make it easy and pleasant and safe to get around a city without a vehicle. Some of those things, some of those changes are making transit easier to use. Lots of transit systems have seen that if you increase the frequency, you may just make that train come every 5 minutes instead of every 20 minutes, then more people use it. If you make the bus come every 5 minutes instead of every 30 minutes, then more people will use that too. If you make it more pleasant, more people will use it. We see all these changes really increase ridership. But active transportation, which is the wonky term we use to describe walking and bicycling to go someplace, these are really very beneficial modes. They're really easy to use in short distances, and with like the advent of new technologies like electric bicycles, you can actually go a lot further distance pretty easily, pretty painlessly as well. But the primary barrier for more people adopting that is that it feels unsafe to use the infrastructure we already have. So adding new infrastructure that provides some kind of physical separation really improves the perception of safety and makes it more likely that people will start adopting these other modes of transportation. So, there's a couple of strategies that we can really emphasize that help improve this. some of the things that we've mentioned are just that in previous work with some of our partners are some of the things that really help people, perceive the environment as being safer for them to use other modes of transportation, or that, there are lower vehicle speeds on the adjacent roadways. You don't feel threatened by a really large machine moving really, really fast right near you. Having a shaded environment with lots of trees that really makes it more pleasant to be walking down a street. I showed a couple of pictures here of two streets that are right next to each other in Atlanta, but one of them has trees and one of them doesn't, and one of them is way more pleasant to walk down than the other one is. And there are a couple other things, like some of these new technologies that have started being implemented in a lot of cities. These micro mobility technologies. In other words, a shareable scooter, or an electric skateboard. I actually see people commuting sometimes on skateboards, and it's kind of fun to see that. But these little new technologies make it a lot easier to address that little last mile gap. That ability to get to a train station or a bus stop fairly easily, so that you can use some other modes of transportation from getting to one spot to another. Can really be improved with these technologies. So really, I just want to kind of wrap it up right there, but just kind of re-emphasize again that if we don't start making these adaptations, we're going to be in a position where our transportation system is dysfunctional and leads to many negative public health outcomes that are preventable if we just make some modest changes to our infrastructure. So anyway, I'll stop right there and open it up for some questions. I'll turn it over to you, Brian.
Yeah. So to start, how can we become involved with your work? Where can we begin there?
And that's a good question. I get asked that a lot in a lot of different meetings with lots of different groups. One of the ways that I think it's that a person can really get connected and engaged in this kind of work is that just remember that most of these decisions are not really made by an individual. Like changing the infrastructure in a city, that's not something you or I can do. That's something that the city decision makers or the state decision makers have to do. And so engaging those decision makers is a great way to kind of help accomplish that change. In other words, showing support. Like if it comes up for a vote, vote for it. If it, even if something is not coming up for a vote, though, staying in touch with your elected representatives and showing support actually does make a difference and help make some of these projects more likely to go forward.
Gotcha. So I'm just curious, and as Atlanta continues to grow, as you showed in your presentation, are we approaching a tipping point where the economic impact will be negated due to the drop in quality of life from so much added traffic?
Well, I mean, that's something that a viewpoint that's come up a lot as well. It's like, well, because that's based on an assumption, and the assumption that it's based on is that as we continue to grow, each new person equals a new vehicle on roadways. If you look at it, if you kind of step back for a second and look at Atlanta in a larger, a global context, Atlanta's really not that big of a city compared to many other global cities. In the United States, it's in the top 10. I believe we are number 8 as metro areas in the United States. But there are many cities ahead of us within the United States that have a much larger population and are still very nice places to live. There's many cities around the world that have a population that's as much as 10 times, or not 10 times, probably too much, more like 5 times bigger than the population of Atlanta, and are very, very pleasant and enjoyable places. The quality of life in Paris, is it lower than the quality of life in Atlanta? They have way more people than we do, but they've grown in a way that does not lead to endless traffic jams. It's because they've grown in a way that allows mobility from one part of the city to the other without having to use the most inefficient and harmful mode of transportation that's available to us. It's not necessarily that each individual person may like that or not like it. It's like it's not physically possible to have a larger a population of 10 million people with the amount of space that we have, all using, a 3,000-pound motorized machine to get from one spot to another, and then have to park it somewhere when they're done. So in other words, to answer that question, I'd say if we grow in the way that we've been growing in the past, we're going to reach a point of diminishing returns real soon if we haven't already. But if we start adapting the way that we're growing, so that we, as new residents come to the city, they are able to actually have enjoyable mobility without having to, add additional vehicles to roadways. It's the only way that it's going to happen.
So And this question is also asked on the chat too. What specific urban transportation policy recommendations would you suggest for the Atlanta area?
Okay, so I mean, there's a long list. Like we have lots of different options to choose from. I mentioned that there's lots of different parts of the world have used different approaches and had various degrees of success. We compared to some other cities in the United States that might have similar sizes to us, we actually have a huge advantage. We have a large heavy rail transit system already in place. It doesn't reach all parts of the metro area. It doesn't reach all parts of the city of Atlanta, but it's there. That's something that a couple other cities would be very, very jealous of. Expanding that could have benefits. Expanding it within the city, using expanding light rail throughout the city would be things that are a little bit more achievable. But also just making the road environments safer for non-vehicle uses, for walking or cycling or using micromobility technologies. For example, putting in physical barriers to separate a cyclist from a motor vehicle, reducing the speeds on roadways. There's lots of design elements that can improve safety in that way. Making the signal timing easier. So if you're a pedestrian, you're trying to go from this side of the road to that side of the road, you don't have to stand there for 2.5 minutes waiting for you to get a pedestrian signal. Or lots of places, you have to actually go physically push a button somewhere in order to ever get a chance to cross the street. These little changes make it easier to get around on foot or on a bicycle or micromobility, but they don't cost a lot of money. And if we start making it easier, then more people will do it.
And a quick follow-up to that question, because on the chat, someone asked, how do you tackle these policy recommendations in a state that doesn't really see a high value sometimes on these initiatives? Do you have an answer to that?
Okay, I mean that's a good question. That's definitely something that a lot of people have and a similar thought that a lot of people have expressed to me before. It is true that the state of Georgia and the city of Atlanta, if you look at the funding mechanisms for transportation in Atlanta, it is different than the relationship between the state and the city and some other places. However, I think that it's important to remember that the city of Atlanta, or the Atlanta metropolitan area, is the majority population of the state of Georgia. It's in the state of Georgia's interest for the Atlanta metropolitan area to have good transportation infrastructure. And maybe it will take a couple of election cycles or just changes in the boards that make up the decision-making authorities to kind of start steering more of funding mechanisms to modes that are more scalable than the mode that we've been using. I think that's something else that can really be said to address that question, is that the way we have systems in place for how we fund transportation. These systems have been around for decades. They were established in different eras, and they're not really responsive to our current needs and our future needs. And so that kind of makes a system that's more difficult to change. So in other words, like, we are spending large sums of money to fix an intersection where Georgia 400 and I-285 come together. Nobody voted on that. There wasn't an election. Like, you didn't go to the voting booth, back in 2016 or something and see, oh, do I want to approve this or not? But if you say, hey, we want to expand, the rail system to this kind of, well, everybody has to go vote on that. Do we want to spend some of our tax dollars on putting a street, or changing a sidewalk or a cycling path in the street? Well, you have to go vote on that, frequently. I'm thinking of a couple of some of the ballot initiatives in Atlanta over the last couple of years. So like, these funding mechanisms are old and they are hard to change. And if we make some adjustments to this so that they more reflect what our future needs are, we will start to see accomplishments happen more frequently.
Gotcha. In your presentation, you mentioned public transportation being the safest form of travel. Can you unpack that for us? What do you mean by that?
Okay. Yeah, I just kind of included that, as one of the bullet points on some of my slides here. So the what I mean by that is that if you just look at your risk of an injury, your risk of a fatal or non-fatal injury, and divide that out by the number of miles that are traveled, the math is pretty clear. It's the safest form. It's safer than driving a car. It's safer than walking. It's safer than cycling. It's the safest mode out there. If you wanted to be more specific, in terms of some specific type of injury, well, maybe it might be a little bit different. But if you just look at any kind of injury, fatal, non-fatal, it's by far the safest, and that's just really based on the numbers.
Gotcha. So here's another thing that we're all hearing about right now. Are autonomous and electric vehicles the solution to the problems you're presenting?
Well, let's talk about electric vehicles first. So with electric vehicles, really the key change there is that the motor is different. The motor has a different energy source. And because it has a different energy source, that means that electric vehicles do not have tailpipe emissions. In other words, they don't have an exhaust pipe with something coming out of it, something that's toxic and dangerous. Okay, that's great. If you were to compare electric vehicles to an internal combustion engine vehicle, that is a huge improvement. Something that doesn't change, though, is that when you stop an electric vehicle, you still have to hit the brakes. Electric vehicles still have tires. Those tires still wear down, and those particles go into the air. We breathe them. They're toxic. The electric vehicles, at the first couple generations of electric vehicles, they were smaller because you have a huge advantage of having a light vehicle. So the first couple, just think of like a Nissan Leaf. The first couple generations were smaller, they were lighter, and so they had less emissions from things that are caused by the weight of the vehicle. Your tires wear out faster if your car's heavier. But since the more recent generations, well, it's like, well, why don't we make these vehicles bigger? People want like a big SUV. Why don't we can make a big electric SUV? Well, to have a motor in a big enough to run that and have a range long enough to have something that's marketable, they have to have huge batteries. The batteries are very, very heavy. It ends up being a heavier vehicle than a similar class of internal combustion engine vehicle. In other words, it's heavier. It has more emissions from things like brake pad and tire wear. It also means if it hits you, it's more likely to cause an injury. If it hits another vehicle, it's more likely to cause a more damage. So that increases that negative public health effect. If you swap them all out, just change the motor and all the vehicles out there, well, you still got to park them somewhere. So you still have all the disadvantages of parking. You still got to drive, you still had the same roadways to drive in. So you have all the disadvantages that are related to congestion are still there. It's just the tailpipe emissions have gone down, which is definitely good. Let's not undersell it. It's definitely good. That's definitely better. But it doesn't address many of the other negative effects as well. Now, if we switch over and talk about autonomous vehicles for a second, I think it's a slightly different story. The first thing I'll say about it is autonomous vehicles are like this thing that's always seems to be a few years out in the future. We never really get closer to it happening. So I'm not really, we've kind of been trained to be skeptical over the last couple of years about exactly when these things will be adopted. But one thing that is true of autonomous vehicles as well as other rideshare, even if a human's actually driving it, a rideshare type service. One thing that if you think about it for a second in this way, you kind of see that it actually leads to more driving. What happens is if you're driving yourself from point A to point B and you're using your own car to do that, then you'll make that trip. So you have the miles of point A to point B, then you're going to store that car somewhere. If you are using a ride share, then you're at point A, you open up your Uber app or whatever on your phone, that vehicle somewhere else, it comes to you, you get in it, it goes to point B, and then it goes somewhere else. So all of that somewhere else gets added to the trip distance of point A to point B. So if you add that up across the whole population, then the number of miles traveled actually goes up. So all of these problems we've been talking about that are related to large numbers of miles traveled actually increase, not decrease.
Okay. Well, and I know we're almost out of time, but we have a lot of good questions. So I'm going to try to push through because I think you've really struck a nerve, and I think in a good way with the folks on the webinar. So I think this is one kind of also asked, this can be overwhelming, this topic, and it can feel so big that, I mean, I'm sitting here kind of sweating, just thinking about, oh my gosh, how am I going to handle all this? And how do I manage and make a difference here? So I think you kind of answered this, but I don't know. What's one small sort of way that we can make a positive impact? How can we get started? What can we do to try to solve these problems?
Yeah, well, I think I included some information on this particular slide right here. It's like it comes up a lot in a lot of environmental health issues. In climate change, this comes up all the time. What's the difference between like an individual action and a social action, a policy that a society makes? And there's lots of tug of war between these two things. It's as individuals, we do have choices that affect our own behavior, but we really can't change what the whole entire city looks like. But if some of the things that do kind of fall under the umbrella of an individual choice that you can make, like choosing to, a short trip that you could walk instead of driving, well, if you walked instead of driving it, that would be an improvement. If you can use transit for your commute, I know many people don't have that option, but if you do have the option, doing it actually makes a benefit. If you are driving, then you can, if you choose to drive a more efficient vehicle, that's an individual choice. That's a benefit. If you're driving any kind of vehicle, if you choose to drive in a very conscientious way, in other words, you're driving a slower speed, you're driving at the speed limit instead of 10 miles an hour over the speed limit, if you're stopping at the yellow light instead of flooring it and going through it, all of these things have effects that end up making it more have benefits and make it more likely that other people will be able to use that same space without feeling threatened by motor vehicles.
So real quick, here's a couple of questions. One was about the Beltline. It's been a big economic driver of late, and they're just wondering, have there been any studies to assess the impacts on the health of residents with the Beltline? And on a related note, how can the Beltline model be adapted in other cities?
Okay. To address those questions, we've been doing some studies on that, and we're proposing to do a lot more related to transportation projects such as the Beltline. I wouldn't call it an elephant in the room, but it's actually a bigger than that. I would say it's more like a whole troop of elephants in the room. Is that when you start making changes like this, people really like it, right? They are attractive changes. People flock to that. So we've seen that with the Beltline. When we start making these changes to the infrastructure in that area, it's very, very popular, and lots of people want to live near it and be able to have access to those amenities. The supply of the housing that's near there has gone up, but it hasn't gone up as much as the demand's gone up. So of course, the price of it has gone way up. If we don't, we have to have approaches in place ahead of time to kind of address this issue that that these improvements in quality of life are also going to cause the price of things to go up. So this becomes a separate issue that we also have to tackle at the same time. The other part of that question, I think, is how can we kind of like expand this to other areas, to other cities? Well, one thing that was different about the Beltline that may not be true about any other roadway is that, well, it was an unused space. It was an unused right of way, and the history of the Beltline is it had been a rail line for making local deliveries. Who owned that space was different in a lot of different parts around the city. It was actually really expensive to kind of get all those parcels put together. But the fact that they existed was something that may not be true everywhere. So a lot of other cities did have some kind of system like this in place. For example, in New York City, there's one in Manhattan. The High Line was like an elevated rail line that was used for the same purpose back in the day, and now it's also been turned into a pad. I don't really think people use it for transportation as much as great places to get a selfie, but it's something similar in another city. There are a couple other cities that have some of these that have started to make some of these kind of changes as well. But once you start moving to like from a unused space to a space that's already being used for something else, so in many of our roadways around the city are kind of overbuilt for how many vehicles use it. So if we do what we sometimes call a road diet, where you use, like, say, one of those lanes to be devoted to some other use, like, say, putting in a physically separated bike path instead, that actually makes people more likely to walk on the sidewalk there or use that corridor as a place to, for transportation purposes. And there's a couple of examples around the city of Atlanta where we're kind of starting to do that, and there's many more that are on the drawing board that in coming years that we will be doing that.
So on that note, someone asked, what's the best and worst things that are currently planned for the Atlanta metro area?
Oh my goodness.
That's a big one. I don't know if there's one or two big.
Yeah, and it's like, oh, how can I really say what I think the worst one is? The I think continuing expansion of the Beltline is probably one of the best ones. There are a couple of other projects that are mostly on the western side of Atlanta that are increasing non-vehicle transportation space within the public right of way. There's a couple of projects over on the east side that are doing something similar. And anybody's ever driven on the DeKalb Avenue corridor kind of probably has firsthand familiarity with the state of that roadway was pretty poor for a long time, and it's recently been resurfaced. But the resurfacing is really just the first step in a longer project to kind of reevaluate how we use that space. So allowing there aren't, and again, this maybe there's some people here are familiar with the geography of Atlanta, but in the eastern side of Atlanta, there are really very few corridors moving in the east-west direction, at least long distances, and DeKalb Avenue is one of the few. And it's one of the ones that, if you could have if you were over somewhere on the east side of town, you needed to get to downtown and you wanted to do that on a bicycle, where would you go? And DeKalb Avenue is one of the few places where you actually could do that. But there are major safety risks on that roadway right now. And if we address some of those safety risks, that would improve access, give more people more choices about how they're going to get around.
Yeah. And this is the final audience question, but I think it's a great one, especially for those that are watching. They ask, as an undergraduate public health student, how does one become a part of projects like this, and whether employment-wise, research experience, etc.? Do you have any advice there?
Sure. We are just starting. When I say we, I mean myself, as well as other faculty members at Georgia State University and various departments around campus are starting a series of projects where we're looking at some of these projects or these infrastructure projects. So what we're doing is I'm working with the Micromobility Lab, which is headed by my colleague Fei Li, who's in the Urban Studies Institute. And we are looking at how planned project, in other words, projects the city of Atlanta has said we are going to do this in the next several years. And so we're going into the areas where these projects are planned. And then we're doing a before and after the project has been implemented and see what the changes in both perceptions of transportation and also things like, give people wearable devices to measure their physical, see how they actually move around and see if this changes as we implement some of these projects. We're just starting to ramp up our recruitment for this. And so we definitely need student help to accomplish this. And I would, specifically about that, I would say if you're interested in this, if you're an undergraduate or graduate student at Georgia State who's interested in this, just send me an email. You can search for me find my faculty page and find that email real quick. Just send me an email and I'm happy to talk with you offline.
Great. So final question, you kind of hinted at there, but where do you see your research in 3 to 5 years?
Well, I think this is a lot longer than a 3 to 5 year long task here. It takes a long time to make these type of changes. It doesn't just happen like that. So I see this being the rest of my career, really focusing on these kind of issues and both measuring and the health improvements that come from changing our transportation infrastructure and also advocating just to make it happen more often. We've seen the benefits in other parts of the world that have adopted these kind of approaches. The health benefits are huge, and I would love to see that happen in the United States. It's like why does Paris, France, have to have such a better infrastructure than we do? We can have that too. Like we know how to do it, and we have enough money to do it. So why don't we do it? Let's do it. That's what I see my career being.
I like it. Well, we'll leave it there. Thank you so much for attending the Currents of Public Health webinar today. And I want to thank Dr. Greenwald for a very informative and fascinating conversation. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you'd like more information about our programs or how to support the school and its work and our students, please visit publichealth.gsu.edu. Thank you again to Dr. Greenwald, and thank you again for attending. Please join us for our next Currents of Public Health webinar on November 9th. Our guest will be Dr. Alexander Kirpich, who is an assistant professor in the Department of Population Health Sciences in the School of Public Health. We'll see you next time.